Okay, it's 6:02. Welcome everyone to the September 14th, Thursday night Board of Health meeting. First agenda item, open meeting. Second, roll call.
Dan Grabowski?
Yes.
Gus Steves?
Present.
Jasmine Canonis?
Yes.
Nick Dado?
Excused.
Excuse, thank you. Kevin Spillane?
Present.
Thank you.
Agenda item number 3, accept the minutes.
Motion. Second.
Gus Steves? Oop,
I'm not, sorry, the minutes were August 10th of the last meeting. I
Thank you.
apologize.
Gus Steves?
Yes.
Nick Dado, excuse. Jasmine Canonis?
Yes.
Thank you. Dan Grabowski?
Yes.
Gus Steves?
You mean Kevin's fine. You already asked
I
me.
have you twice. Kevin
Yes.
Spillane, thank you. It's been a long day.
You usually get the vote twice.
All right, motion passes, thank you.
Agenda item number 4, citizens forum. Are there any citizens that want to speak on behalf?
Do we stand, do we go forward?
Over here.
Just come up
Please come forward.
just a little bit so we can. Come on, that's fine. You can sit right here if you like, as long as you're up front. Yeah.
All right, great. So we'll introduce ourselves as kind of two organizations. I'm Dr. Sarai Rivera, and I am Director of Program Development as well as Community and Governmental Affairs for Renaissance Medical Group right here in Southbridge. So you can see folks. And we're in partnership with Wellstorm.
Okay, my name is Justine Rudd. I am one of the co-founders of the Wellstorm Peak and the treasurer. And I'm the co-founder and president of the Wellstorm.
So we're presenting before this body here today to be able to talk about the partnership that we're looking to have, that Wellstone would be the organizing agency, and it would be in partnership with RMG because of the physical space, and proposing a change of usage of the building in order to be able to do a shelter for homeless, specifically focused on elderly or 55 and over, elder adults, 55 and over, disabled and veterans. What we're seeing now is and it would be right here from Southbridge. What we're seeing now, just an ever increase. I know that in my career in healthcare, this has been in about 30 years, I think the most that I've seen older population as homeless. And so I have several cases that we've had to send people to Worcester, and they're from this area, and it's very difficult. Also, the open shelters are mainly for chronic homeless, and it's really not equipped for this population either. They have a wet shelter, and the only time sometimes I can get them into what's called their dry shelter, which is a better system, but they're still not equipped for some of the needs that the older population may have. Couple really quick information. We would want to do about 12 person and do it in 4 people increments, so that would eliminate community impact. The reason why we would want to have it at RMG, where we propose it there, is we do have the day center. We're part of the Anchor mission. We're very anchored within our community. We have partnerships with, I'm on the board of Harrington Hospital, UMass Harrington Hospital. And so we would connect with like the UMass Urgent Care, the ER. And what we're looking to do is making sure that people can kind of get stabilized. And so we would be we've been working in collaboration with the CEO of Central Mass Housing Alliance, Leah Bradley. And she's been coordinating what's called the South County Housing First Task Force, which gets all the different areas to have some responsibility. So for example, Spencer recently opened a shelter. Webster, we've been meeting in Webster as well, and Webster has now allocated some funds for hotel and be able to kind of work. So the issue is that a lot of times we have people come from different locations, and we want to be able to service the Southbridge community right here in Southbridge, which we haven't been able to do. Right now, what we would coordinate looking at utilizing in the evening security, CNA staff, as well as case management. Our facility is we're DPH. That's another reason we wanted to have it there. We're completely DPH. We have showers and bathrooms all handicap accessible. We'd also have lockers, and we would probably do a very small, probably like not really a clothing bag, more like a clothing bin that would have the basic essentials for people, such as t-shirts, coats, socks, sweats, leggings, maybe some like sneakers and boots for people that wouldn't. We would need to be able to establish some cots, linen that would get laundered on a daily basis unless the person is staying there. It was a goal that would be on a referral basis, so not just walk in, and the people would be triaged prior to and upon discharge. The whole goal that we're trying to do with this type of design of shelter is very similar to what SMOC has regarding the MLK Dry.
Yeah.
This would be a dry shelter which you can only go in by referral basis. And you have to be working on sobriety in order to be actively, and you have to be actively working to be reestablished. So I've actually had to place some people from Southbridge there. They've been very good. I work a lot with SMOC, so they've been great. So for example, we have one gentleman who was homeless and he was a veteran. He didn't have his DD-214. He had just misplaced some. My husband's a veteran. He misplaced his too after so many years. And Counselor Adams, Dave Adams actually helped us to get the TD-214s, and once we did, we were able to then get him out of that shelter and put him in, and now he's with Veteran Services and he's more established. We're finding people, another example is a woman who is relatively young, she's only about 57, but was diagnosed with Parkinson's, had always worked. And being diagnosed with Parkinson's, unfortunately, her symptoms became very drastic very quickly. And at first, before her medication was able to be properly put in, she could barely walk, she couldn't work, led her to lose her apartment, and now then was literally couch surfing. She's in the process of getting disability, but as you know, Social Security disability, I mean, I have people in wheelchairs that are getting denied.
Yeah.
And so in that process, you know, it really broke my heart. Someone who had worked in the community, who had given so much, is now in this situation. And so those are the kinds of folks that we want to work with. We have another woman from here in Southbridge, and she had to stop working. She got diagnosed with cancer and heart disease. We worked with Harrington Hospital to be able to get her an appointment relatively quickly, which actually helped save her life. Because within a couple weeks' time, she ended up needing heart surgery. Had worked all her life and only because of illness. So this is what we're seeing, is this kind of community and population. And what we would want, because we would have it at RMGRC or an agreement, because there during the day they would get triage and it would minimize community impact. It's not a highly residential area, so if they choose to leave during the day, it wouldn't be a community impact. It wouldn't be like a shelter of like 70 people going out into the community, which is a good thing. And then the other thing too is that they may qualify to actually participate in our adult day health center.
Sure.
So that would eliminate them from even having to get out. But also this would come with case management, which Wellstorm, where they're clinically equipped to be able to provide. And so that's kind of a little bit of the overall, really quick synopsis, and we're open to questions.
Can you explain to us what the difference between a wet and a dry shelter is?
Yeah, so a wet shelter is someone who is probably not able to, has not been actively working on their sobriety or still struggling with substance abuse disorder and is actively using, or alcohol, you know, any type of substance, alcohol or other types of drugs. In a dry shelter, you have to be sober or really actively already working on your sobriety.
A couple of questions come to mind. As to somebody that just opened up a respite actually in Dudley, and it was actually is a crisis alternative for mental health. I've actually, this is my third respite that I've opened up in Massachusetts. Would it be 24 staffed 24 hours?
So this particular shelter would be, they would be coming in at 6 and leave out by 7 a.m. However, because because RMG has now, as far as like Wellstorm, right?
Sure.
They're triaging people coming in and providing the staffing and everything for the evening, and we would collaborate with our staffing. During the day, because we run an adult day health center,
Right.
which we're actually part of also the anchor mission from UMass Harrington, they would be able to most likely qualify for services.
Sure.
And that's another thing, that a lot of these folks are in need of medical care. They can't qualify for home care or nursing, visiting nurse, open wounds, all sorts of things, but they can't because they're out, they're homeless. So
Right.
that's an issue, and this would allow them to be able to get those type of services, because most likely most of them would probably qualify for
Sure.
adult day health,
Yeah.
which that means they would be staying there the whole time.
So this would be a step down, like what we would like integrate back into, you know. Now, are they coming with housing plans, or y'all are establishing housing plans there?
That's what Wellstone will be doing. The whole goal of this, everyone who comes in, there has to be a case management component. We're trying to place them. And we do understand that we have definitely a housing crisis. We actually had the new Secretary of Housing, Secretary Ed Augustus, come visit us at RMG. He was at RMG a month ago. And so we talked a little bit about some things that we were looking to do, because there really isn't, we don't have that equipment here. I think it's only St. Luke's, and it's just always really, I've never been able to get anyone in. All my referral goes straight out into
I had to
Worcester.
put it as a respite. I couldn't utilize the word shelter. I had to,
Yeah.
my funding had to, I wanted to. As a matter of fact, Nicole Duffy was on the board before, and before we had tried to establish something, and I couldn't utilize the word, like, there was so many barriers and like restrictions.
Yeah.
And so I had to call it a respite and then go
Yeah.
through those
And our goal
things.
is that we don't want to have people long-term, we want to be able to circle them, but as you know, everything is a wait. Everything is problematic. If we can get them into like veteran services, for whatever
Exactly.
reason, then we get them into veteran services. If we have people regarding domestic violence, and we're going into those domestic violence shelters. And so a lot of what we've been able to do is establish those connections and partnerships with some of those outside agencies that we begin to filter out and begin to establish, you know, whether it's the Abbey House Shelter, SROs, micro units,
course,
all
yeah.
those things that are really looking at that.
Raft,
That's
first
our goal.
class. yeah.
Everyone is coming in with, we're creating a plan for every
Ah,
individual.
what's your length of stay?
It's gonna be hard to say. We wouldn't be able to say a length of stay right now, only because we've established that we do have a housing crisis in the state of Massachusetts.
yeah.
And so we would say that that would be difficult right now to be able to say. Our goal would be able to get people established as soon as possible, because I'm sure them as well as us, no one wants to kind of maintain the shelter process. But right now, because of the crisis that we're dealing with, and even right now, the subsidized housing, what is happening now is that people are not able to afford
They can't,
their,
yeah.
you
Even
know,
the working
market rate
class- the
apartment
working
or
class,
apartment,
yeah.
you know. So even people that were working, or people with their social security that once upon a time could afford an apartment cannot any longer. And what we're seeing is that as apartments are becoming higher in the Worcester area, people are coming into Southbridge.
Yeah.
And then what we're finding is that now these rents here are becoming higher.
The state of emergency has also
Yeah.
played a big impact on all
Exactly,
this.
that's a problem.
Yeah,
Mr. Swain has a question. Just clarification on something. These, up to these 12 people, they're gonna be spending living, well, I shouldn't say living, but spending the evenings in the RMG building? Is that-
Correct. That's what we would need, what we had talked about when we talked to the CEO, Leah Bradley from the from Central Mass Housing Alliance in the South Task Force, South Collaborative, or South County.
South County Collaborative,
Yeah.
I'm on that, yeah.
Yes, I need to look familiar. It's the whole Zoom, right? We like see each other all the time on Zoom. So, yeah, we would have that established, we would have them there because we have the space, it's handicap accessible, we have bathrooms, showers, all equipped in that area. We would have cots established in the evening with security, CNA, and staffing. And then just break up the cots, but they'd be able to keep probably like a lock bin and a locker.
Now, have you gone through, if I may, gone through or checked in, is that building even adequate or considered to be a livable space through either the building inspector's department, zoning,
zoning.
or
So that's exactly, so if you were to ask the procedure that I would have followed somewhere outside of Southwood, that's what I would have done initially, but we were told that we had to present, so we have to get a change of usage. So we're fully equipped because we're public health certified, like what we do during the day, like the particular area that we're looking at is an adult day health center, it's not just a day program, it's an adult day health center, so it's completely equipped and approved by Department of Public Health and all the bells and whistles that has to go along. It's checked and rechecked and every which way, fire, inspect, the building as a whole. We function as a medical building, so that area. As a living, we would have to, all we would need is looking at a change of usage. Because it has all the equipment and fire and whatever have you, it's good. It's just a matter of that people, I think a lot of times change of usage is to be able to know that surrounding, if anything were to happen, that fire, police, people know that there's a change of uses, there's people there in the evening, because normally that wouldn't happen, right? It's during the day, so just so they know. But what we're looking at now with the state of emergency, that most churches don't even need to ask for change of usage. But because we are a private business, we would. But yeah, we're in full, like we said, we had the Secretary of Housing there, and he saw the facility. We've had Leah come by, and some of the colleagues from the South County Housing First Task Force. So because we are certified, that's one of the reasons why we wanted to partner with Wallstar, because they don't have the facility, and having to get a facility, equip it, and the whole nine
It would have been more.
would have been a whole other process. This is already kind of ready, that all we would need to do is change of usage. So if we I guess what we were told is that there's approval here, then we would go before the town council.
Thank you.
Okay, if I understand what you're saying correctly, personally, what I think you need to do probably is go to the planning board.
That's what we.
That's what we thought, because that's what usually happens. I serve on the public health and I serve on the council in Worcester. So anything like this would go before the planning board, but we were told no, that we had to go before the board of health. We thought it was to usually go through the planning board presents it to council, we get a change of use and
But that's
we go, especially because we're an already established institution.
Yeah, and then we would,
that is weird.
I think so
I have
too,
never
yeah.
heard something like this coming to the Board of Health before.
Yeah.
yeah.
Although you are being a health agency, that may be the weird quirk
Maybe.
of the law.
Yeah.
Do you know anything about this, Dan?
No, it should have gone the other way.
Yeah,
Yeah.
I think so too.
It
And
should have
that's what
come,
I-
but
Yeah.
that's fine, what's done is done.
So we're trying,
And that's what I first told them, I
And this is
said, no,
practice.
we're gonna schedule to come, we were gonna schedule to come before, to present it as a petition before council, which then would probably go on to planning.
To plan it,
And
correct.
then from planning, go
That
back
would be
to
the
for
norm.
final, and then go planning to final approval. That
Yeah,
was what
yeah.
we thought, that would have been procedurally what I thought as
that's what I thought would
well.
happen too, yeah.
But when I presented that, they said, no, Wellstone was told that we had to come here to the Board of
Okay,
Health.
who told you that?
Yeah, because we would only
It's
vote
okay,
on the
it's
parts.
water
that-
over the dam,
that-
right?
that-
You're here now.
I mean, at the moment, right, under this, in this particular setting, we can't do anything right now.
Yeah.
Because we don't have any plans in front of us, we don't have a public hearing set or anything.
Yeah,
I
yeah.
mean, we're just talking at the moment, trying to figure out what's going on.
Yeah.
Exactly.
That's not
What we're
figure out
trying
what's
to do is
going on.
get a change of use, and ideally, it would be ideal to be able to start and pilot the program before the winter comes in.
Of course, yeah.
Especially to start off as a seasonal shelter, and so I think even if we can get approved initially as a seasonal shelter,
I think even
and then
with all
the
the
seasonal
documentation,
shelter
that's not
could
gonna
then, we could then evaluate it in the spring to see if we can be a year-round shelter, which would have a less commitment by the elected body, and this community to be able to be a seasonal shelter, which is really was our initial anyways, which was our major concern.
Right, yeah.
Okay.
That does make sense.
When do they?
Yeah, because
Well, I think our petition has to go before the council first.
Yes.
I think we have to
Council?
present
And
a
then from
petition,
there,
and then
they'll
from
send
there, they refer it to the planning, which when we present, and then whether it gets approved or
No, I
not, and
think
then it
here's
goes back.
different. I think here is planning and then town.
So,
Council.
My recommendation is go to planning board
under
first.
normal circumstances,
Okay.
nothing, the planning board does not refer anything back to town council.
No? Okay.
They make the final decision, except for zoning changes.
Okay.
The actual change of use is entirely in their hands, as I understand it.
Yeah.
I'm not quite sure, quite frankly, I'm not honestly sure why you're here.
Yeah, I'm
Yeah,
baffled.
we were kind of like baffled as well, so.
Well, come on.
I mean, I could see, given what you're
I think it's a
doing,
good
that
thing.
that you might want to get some ideas from us and maybe work with us to make it
Yeah.
work right. I can understand that.
Yeah.
But, I mean, we have no legal authority over changes.
We
of
we don't,
use or
because we don't have the
anything. That's
plan,
not
the
our bill,
blueprints,
you know.
or, yeah, or any, like, yeah, so I,
Okay.
Um,
So town council then?
So do we go to the
That
council
would
or
be
do
the
we
planning board,
petition?
that's the planning board.
That's a planning board. Go to the planning board.
So where do you usually do your petition for planning board here?
That would be downstairs, talk to Peggy.
Okay.
Peg-
Is she there
She,
still?
she's,
Probably here.
well, she's the
Sorry.
economic development
Is here
director.
late?
That's
Our
right.
planner, we've got a
Yes, I
temporary
did see
planner
her
at the
earlier.
moment.
She's here now.
She's
Yes.
here now?
She
I'll
should
go
be.
downstairs.
Yeah,
I
she's
saw her.
Earlier.
Okay, so we'll do
Regardless, thank you for sharing the information.
Yeah, at least you guys know. At least y'all
Sorry.
let us know we're in the know.
Don't say we did not
Yeah.
no, we wish
I
we
don't
could
know
be more
exactly how
helpful.
they'll react to this.
Yeah.
But one of the issues you might have is the fact that you are currently a business, you're not residential,
Correct.
okay?
Yeah, that's
Although
what
you are
we want.
literally right next to a residential zone.
Yeah, we are.
With the apartment complex.
Yeah.
Yeah.
That's why they were asking that we would need, when we talked to like the CEO or like.
A change of
housing elect,
usage, yeah.
That we would need a change of
Change of
usage. And
usage.
once we had the
Yeah.
change of usage, we would, once we had the change of usage, it would give them an opportunity to apply for the proper funding.
Yeah.
Which is true.
Yeah.
Yeah.
If, the problem is, I don't know if it would be legal in that zone. You'd have to clarify that with Peg. Because I don't know,
Oh, we
I
can
don't know
find out
how
too.
this
Yeah.
zone works.
She'll
And
tell
I
us.
think,
I'm not a planner.
yeah, I think with the
I just know there's a
potential
bunch of
of,
issues.
the
Yeah.
emergency, the state of emergency that we have, this, Because right now, like, before churches had to petition for change of zones, and now they don't. But this, because it's a business, it would have.
Churches are exempt from a whole slew of things, they can
Yeah.
go in any zone,
Yeah.
but businesses can't. And
No,
the
but the
fact- and the
sheltering
fact that you're-
specifically, because we couldn't do
And the fact that
shelter.
you're mixing a business with a residential use, there are certain, there's a whole bunch of requirements for that.
Yeah.
And there are certain zoning for that, like I know the central core zone allows that under some circumstances. But some of our other business zones don't.
Okay,
And I don't know which one you're in at the moment. so.
okay, good to know. All right, great.
All right, well, thank you.
Thank you.
Good to see you all. No harm in that, it was some good information.
Yeah,
It's an interesting proposal.
that was a good pitch.
Good luck.
Thank you.
Okay, at this time, I'd like to stop our regular meeting for the 6:15 hearing. Requested upon by M&S Smoke Shop, LLC, 14 Hamilton Street,
6:15 open, what time is it?
It is
6:23,
Thank you.
24. Okay, we ha-
And before proceeding, Joan Hamlet, the director for the Tobacco Control Alliance, did give me a call today, and unfortunately, she is not able to make the meeting tonight, because of medical issues.
So we'll conduct a hearing. Who are you? Can you give us your names, please?
Mohamed Omari and myself alone.
And are you owners?
No, I'm the manager. My wife, she's the owner.
Oh, so you're representing M&S Smoke Shop? Okay, that's fine. We have a violation here that has the offering for sale a flavored tobacco product or tobacco product flavoring enhancer.
It's,
And one more violation. The second one is failure to maintain a record of the documentation submitted by the manufacturer or manufacturer's agent certifying that such tobacco product does not meet the definition of a flavored tobacco product or tobacco product flavor enhancer, and the product lacks any characterizing flavor. And this is the second violation within 36 months. And the first violation was already taken care of.
36 months?
Well, so this is the second violation within 36 months. In other words, you were here before for another thing within 36 months.
Yeah.
But you weren't up here, but you had another violation. So this would be the second this is a violation.
Mind if I ask the director here?
Yes, go.
Okay, can you clarify, do you have the dates of the previous violation?
Yeah, 625 people.
No, I mean, is there something other than that?
We would have to look at the file right here,
I mean,
which we
is
have.
there a previous violation for this particular 629 incident? Because I don't, if I'm under the impression, if I'm correct, this 625 violation doesn't apply to this one, because it's not the same charges.
Right, no, 625 was paid.
It was
I know.
taken care
Yeah,
of, but.
the 625 is the one that was paid.
Right, but it was,
Yes, I understand
right,
that.
that was,
That
But,
would be the first offense within 36 months.
but I'm referring to the second violation, if it's the second violation
629.
of, but the second
629.
violation of sale of flavored tobacco products. you know
Within
when-
36
When the
months.
first one was.
The first one was the sale to minors of
No, it is,
625.
they're not the same thing, they're not the same charge. I understand that they're not the same charge, that's what that is. It's not, they're not cumulative, they're the same charge.
so the violation that was paid, that's not, this has nothing to do with the sales of tobacco, that's just altogether a different violation?
Yeah, 'cause they sold to an
Right, so
underage
in other words,
It's the
so
first
this
time
would,
for
so
this
this would be,
violation.
so this would be the first time violation?
No, that's what I'm trying to clarify with Dan, because it says this is the second violation
Right.
for this particular charge of sale of flavored tobacco, as opposed to sale to a minor, which is the one that they.
Right,
that they paid the fine
625,
for,
and this is a 629.
Yes,
Yeah.
so we're not even dealing with that.
Okay,
We're dealing with the
right,
629
right.
one. Maybe we should back up for a second and clarify the 625, if you can clarify that, Dan, since we've got that in front of us as well. Because right now, I know you're looking for something, so back up and let me find what you're looking for.
625 was taken care of.
I know.
I have the 625 right here. That was salient. that was selling cigarettes to a minor, female at age 16 at 12/22 on 6/25. And that was taken care of, so there's no reason for us even, So that wasn't that's just the violation that was taken care of.
Yeah.
So that has nothing to do with anything now, other than the fact that we have this
That would be the
violation.
first violation of that charge,
Right.
which goes onto the record.
We don't, it's not in
So
it.
this will be the first violation for this.
But this is the second violation of the sale of flavored
I
tobacco.
got it.
That's what I'm trying to clarify.
That information is not in their file. We would have to look at it in the electronic file to see if there is actually a first violation within that 36-month timeframe.
Okay, because I think we kind of need to know that to clarify if this actually is a first violation or second violation.
Well, the Tobacco Control Alliance would have had that information if they indicated that. Where they received that, I cannot answer that at this time.
I just wanna know when they opened that business, cause that business hasn't been open that long,
The last year.
within the last year.
Within the last year,
Yeah,
right?
that's only one they come in both times
That's it.
at the same time.
We have
So,
that, yeah.
I know I don't know if it's the first or second violation, but I think it's both the first violation is gonna be like in this time, but I don't
The
know.
first violation for the sales.
For the sales,
Okay.
yeah.
Yeah, that makes more.
Because over here it says second, so, all right, if that's the first violation for sales, and this is,
Put them together.
Mhm.
all right, so,
Because we don't know about the product, it's legal
Everyone
to
says
sell it now. Before this was we selling,
What product are you referring to?
Sorry, the
tobacco.
picture and the.
remember,
The
Because
picture.
we have a very long list
Yeah.
of products.
You see? No, it's same product, but it's different flavor.
Yeah,
It's
but-
King Palm, almost 25, 30 flavor.
So, multiple.
Yeah.
But the King Palm,
King Palm is
something,
before
It's
legal.
legal.
We buy it from IZ, James
and pay
Duffy.
taxes on it,
We pay
everything
taxes
is
on it.
good. But she came to my store, she told me just take all the stuff and go outside. I did that when she in the store. I removed all the stuff. She told me this is illegal stuff. I'm putting the boxes in the damn store next to the store. She told me you're good right now. I wanna go to the boarding hill, I think so.
Yeah.
The boarding hill, and we can see what we can do. And she sent to me the ticket to for the $2,000.
That's like the second violation. That's what
Any
we
question?
got.
so, go ahead, Karen.
For you, Dan, I don't know if you can answer this or not, but if you go to the first page from Joanne, Mary Joanne,
Mhm. Joan?
Joan,
Yep.
Joan, this page?
Sure, when we're down to- Okay.
I don't know if I have this.
Ah, you got that. Go ahead.
So if we all go to that first page, second page, third page, it lists the type of product, the brand, the name, flavor violation, fine, all that.
Yeah, that's good. It's a very long list.
Yeah, it's a long list.
The list you're referring to starts with
starts
the
right
one
here.
cigar?
Yeah.
Okay, yeah.
And can I say something, please? The acid cigar you talk about, I got from James Duffy from Boston, and I got a receipt. I paid taxes on it, and he told me this is legal in Massachusetts. And in Worcester, the other store in Worcester, to my cousins, he got it and it's legal. But in Southbridge, he told me this is a flavor, but I don't know it's flavor because I got it from James Duffy. And James Duffy.
Do you have documentation from
I-
the manufacturer?
After that, when she gave me the ticket, I got a manufacturer right now.
Do you have it with you?
Right now, I got it.
Do you have it with you?
But here?
Yes.
No, I
Side
don't.
of all stuff.
Oh my God, I'm sorry.
So my point of clarification I'm trying to get is if you go to the last column where it says find and warnings, these are all Dutch Master cigars. Why are we finding some, warnings on others, finding some? Why isn't all fines or all warnings? I'm kind of
Because some of them have different products in them that, that are illegal in them. Not everything is made out of the same thing.
What
What
I'm
do you
saying
mean?
is illegal is illegal, so it should be fine, not a warning.
Do you have a picture of the tobaccos? Do you have this picture with you?
Here? No.
Right. Can you please come up here and tell me, this is what the ladies, this is the entire shelf that she circled. Everyone here.
Everyone here,
all-
she told me, is illegal.
Right, those are all illegal. I
Yeah.
mean, this is not one or two products, this is the entire shelf. You're looking at feet. You're looking at feet. You're looking at more than one product. You're looking at about 10 to 12
No,
different.
but this is same product.
But
All
it's
this
different
same body,
flavor.
different
That's what I'm trying
flavor.
to say here. These are all the same products, it's a different flavor, but we're
No,
only
but you
finding
don't
some
make
of
all
them.
of these.
But
Only
look,
morning.
look at,
You make
One
some-
flavor.
Right. He says I'm
No
right.
flavor needed.
So if I may, excuse me, Gus, I have the floor. If I may, because this is the second time we go through this hearing. The other thing I want to bring up for point of information, besides trying to get clarification that when it's all the same product, just a different flavor type, we're only finding some and warning others.
because,
I don't agree with that. It's the same product, it's just a different flavor, that's it.
yeah, the flavor that the second one, the one that says the warning probably has a product in there that's in violation. It could, I mean, Dutch Master could make 20 different products, but doesn't mean they're all legal.
Yes, that's right.
You know what I mean? Am I correct?
That's
Yeah,
it
and
right
so
now.
there's a mix in there
Right.
of
They have it right
ingredients
now.
that some are okay, but the rest
Right.
are
But why
not.
are we only giving a warning instead of a fine?
Because
If
it-
you're giving a warning, that it's still illegal then. It's still a violation.
And they have some of them about the pricing. Some of them they come in with the price on it, and some of them they have no price on it. So I don't know which one is legal and which one is not.
Well, this is, I mean, I'm looking at a picture that has feet. All, some, I mean, these are not one or two products, we're talking a slew of products,
Yeah,
and,
it's a lot of
and another thing is, before we continue anymore, it's not up to us, it's up to you to find out which ones are legal. Not because your buddy in Boston said it's good. I got a buddy in Boston too, every time I listen to him, I go to jail.
True. Not true.
You know what I mean?
Yeah.
I get the cuff slapped on. So it's time for me not to listen to my buddy in Boston. But it's up to the person who's selling this stuff. You ask any manufacturer, any store owner in this town, any store owner, they know what they have for inventory. They know what they have on their shelves.
Yeah.
This is an entire shelf. We're talking feet. She circled the entire shelf,
But
not
I
just one or
think-
two products.
Yeah,
That-
but it's before, I don't know, it's before.
And
like,
another thing
legally
is-
now it's-
Everybody comes up here and says, well, you only make a couple of pennies off it. Well,
No, we're gonna, it's happy to pay, I'm gonna pay, we're happy with that, it's not
I
about
mean-
the pay and it's not. I was saying it's something, it's about the second violation of the first violation, that's what we come in.
Well, we think,
To know.
this would
That's all.
be your
If it's
first
the
violation.
first one for tobacco, it's fine, but we kinda know about it, that's all.
I'm fine
But
with
I
it.
think when you coming together, it's like to be the third violation. I don't wanna be like that, that's the first time we coming in to open. So we taking the first violation, we happy with that, that's fine, and we can give you the check right now.
Okay.
That's what we coming for to know. It's the first or the second, I don't know.
All right.
I have one question.
Can I,
Go ahead.
can I continue?
Gus,
Phil?
Gus and Kevin.
I had the floor, Mr. Chair.
Okay.
Yes,
Go-
please.
Kevin, go ahead. I'm sorry to interrupt.
I just want to bring out some information I brought out at the last time we had this type of hearing, and it all starts with this outside company that the town has that does these inspections. According to this paperwork we got, a violation was done on June 29th, and the Board of Health Tobacco Control Alliance penned a letter to M&S Smoke Shop dated July 13th, which is 14 days after the fact. And this Alliance Company letter comes from either Leominster or Athol. So if you take that 13th of a date, put it in the mail that day, weekend, by the time these gentlemen get their mail, open it up, on the bottom of the letter, it says they have 7 days from the date of this order was served or received to file an appeal. So let's say they received it on the 20th or so. They had until
Then August. You're gonna say
August,
that, right?
they had until
I
August,
understand, because.
if,
I'm sorry.
they have until August 1st roughly to file their appeal. So then, their appeal comes in, actually, before I get to that, so they have to do their appeal by August 1st. The letter that goes out states that their suspension is gonna be served from July 31st through August 6th. It doesn't give them enough time to file their appeal because their suspension is already going into effect according to these dates. These gentlemen just received it. So it's a twofold here, because then what happens is on this Monday, July 31st, we should have already received their appeal. We did not receive it. Did anybody do the follow-up to see if these products and/or fines were paid by that July 31st date and the suspension from July 31st through August 6th? Nobody did a follow-up. We received an appeal letter, handwritten from them, dated August 10th, stamped in the office, received August 10th. Way over that 7-day time frame from here. The other thing that baffles me is this letter from, I'm assuming it's your wife, dated August 10th. We, the town, did not reply to this letter till September 6th, over 3 weeks later.
Can I answer?
These dates that, and I brought it up, these dates just do not add up as far as how this process is done when we have violations. We give them 7 days to reply to a letter, but we take 3.5 weeks, whether it's the town or especially this alliance group. To me, that's unacceptable business. I mean, 3 weeks to reply on somebody that you're gonna fine, in this case, $2,000, which she made the error and said it's the second offense at 2,000, when technically it's the first offense, which is a lot less of a fine and an impact. So with that being said, I'd like to make a motion that we find them not responsible because the paperwork is wrong again. And I think we should have a meeting or sit down and talk to the alliance people to get this straightened out. That's 2 meetings in a row that this has happened. Thank you. That's my motion.
Anybody else have anything to say?
We haven't even finished the hearing yet. Hold off on the motions until we actually ask all the questions that we need.
All right, go ahead, Gus.
Okay. First off, I want to clarify a few things on this list. If I'm reading this list, if you get to the last part of the list, the last several items, are these in fact cannabis items? Backwards items?
And
Last 7 days?
The last items, the ones labeled the ones labeled cannabis, ones labeled at the bottom, the ones labeled joint, the Packwoods items, and the items in the last page, the pre-rolls that are labeled as
Oh, the
Delta,
hem, the
Delta 8,
8.
Delta 10.
Yeah.
Are those
Yeah.
cannabis items?
And the new campus?
Cannabis, as in, because some of the images we have in our
I have,
photocopies are very clearly labeled, let me see, I'll find it.
when I buy it, they come in the receipt,
That one's labeled Delta 8
they
THC.
come in like a Delta 8, whatever the brand it is.
This one is
Delta 8,
specifically
whatever the
labeled,
brand
this is a marijuana product on the description. This one, as I said, is labeled Delta 8 THC. This one's a Delta 8 THC. Dan, you still have
This
the
is
actual
Delta 8?
color copies, right?
This is CBD, this is CBD, plus Delta 8, less than 0.3%. The legal,
Okay.
that's right.
And what about this thing? 'Cause
This thing in the box, I don't know.
labeled as a
This,
marijuana
but
product.
this something in the box, I don't know anything about in box. I buy box closed, I'm not buying, I'm not gonna open it.
Okay.
Maybe this is mistake from the guy I buy from him, it's not my mistake, you know? I buy the box like this picture, let me show me the other picture. When I buy the
What's
box,
the other photos of that one, please?
other picture of the fifth. Yeah, you see, I buy the box like this side, like this.
Right.
All of them say Delta 8.
Mhm.
But this picture inside the box,
Okay.
that's right?
But I'm just trying to clarify what they are.
I don't know.
To be honest, I don't know about it. To be honest, I
Okay.
don't know. But
Because
Just
I
say
know
it right now.
if I can clarify,
Yeah.
because I know that
Yeah,
in Massachusetts, if it
it's a lot
is,
of things now
if it
about
is-
the, yes.
if it, in Massachusetts, if it's hemp, it's legal.
Yes,
If it's cannabis, it's not.
It's not legal.
yes.
Because, specifically because you don't have a CCC license.
So what about, so that's the
Exactly.
8, now it's hemp or it's campus?
I'm not sure.
That's what
Because
I
I'm
don't
getting,
know about.
some of the stuff I've done research on it, I'm getting a little conflicting information.
Okay,
I've talked to the police department,
yeah,
and as I understand from what they say, the stuff that you have is legal hemp,
yeah.
okay? Which is, if it is,
That's
that's
interesting,
good.
that's what we
They-
need to
As
to
far
know
as I
about
know,
it
from
too.
what they say, that's good.
Yes,
So, however, from what I've read from the FDA, Delta 8 and Delta 10 are not legal because they're synthetic,
okay.
whether they're made from hemp or cannabis doesn't matter.
Mhm.
However, that's not what I'm hearing from the police department.
So that
I
means,
don't know what to do with this.
that means it's illegal.
I don't
that
know,
day,
to be honest, I don't know. I am not.
To be honest, now I'll take it out
Gus,
from my store,
alright.
all of them.
All right, Gus,
Take
we
it
gotta be able
out,
to move on.
Because
Anybody else?
it's not about it yet.
We gotta move
I'm
on.
not done yet.
What do you wanna do? You wanna leave? Why
No,
not?
hold on.
And the other items here, we do have, I understand what Kevin is saying. However, I would like to point out that there's a very long list of items in here that are specifically identified as flavored, and those are a violation of state law. I don't understand why some are labeled as fine and some are labeled as warning either. That would be nice if we had somebody from the tobacco control people here could clearly define which is which and why. That would be a good thing to know. But there's so many of them that quite frankly, even if we eliminated the ones that are just labeled as warnings, there's still a pretty clear list of violations here. I would agree that since we cannot clarify whether we actually have documentation of this being a second violation, I think it makes sense that it would be a first violation. Is there anything you can clarify about this situation, Ben?
No, I cannot, because I did not do the inspection or the enforcement. And now our Alliance is on the Tobacco Control Alliance
Right.
to conduct these inspectional procedures
Yeah, I know.
properly and do the follow-ups.
Right.
Unfortunately, they are not able to be here. And whether this stems from the discrepancies with the dating, again, that is their responsibility. So that underscores the importance of having all of these procedures done properly in alignment with the law,
Right.
and having the paperwork to demonstrate that it was done correctly, which unfortunately, at this point, has not been fulfilled properly, in my opinion.
Okay, so
But that is
as
my opinion.
health agent, as our employee and health agent, what do you recommend
In terms of,
in terms of how we address this particular situation to make sure that it's fair, but that it doesn't happen again?
We're the board, we're supposed to do the
I understand.
recommendation,
Yeah,
Gus.
I know.
We-
recommend
we-
to
we-
have-
we-
you
we-
can't, you can't do it that way. It goes the other way.
No, he works for us, he can recommend to us.
This is open and shut now, guys, if we kill this. I mean, I suggest when the Tobacco Alliance comes in next time on any kind of violations, or when they come in here, they can explain all this. But tonight, we're talking about what they had on the shelves.
I understand.
And according to you, in your own words, a lot of this is illegal, and I believe it, and this is why I'm gonna vote for it as a first offense.
Well, we can't
But
because we don't know.
we have to,
You
we can't agree on the first offense?
No, I think
Because
we need
they're
to
charged
put,
with a second offense and it's wrong.
we need
So
to
that's why I
bring
made
it
that
back
motion
to
to
the
find
table
out
when we
responsible,
have-
because the Alliance screwed up
that
all
is
the
another
paperwork.
one, sure.
yeah. I think we need to bring it back to the table when we have all the proper information and revisit this.
So we can't make a vote on this tonight unless we find out all the
That's why I
facts.
made the motion, find not responsible, because we as the town who hired this company that screwed up on it, it's our fault, we can't blame him for it, and in my opinion, we can't ask the company to come back because we screwed up. So that's why I made the motion to find it not responsible. It's our error as far as in my opinion, it's our error
I can't
that was
let,
done on that.
I can't let this go. There's too many violations. There's a whole shelf.
That was on the other one too.
There's circles everywhere. Half that store's in violation. I can't let that go. I mean, unless we vote on it to let it go, I'll tell you right now, I'm not gonna let it go. I mean, it's not one or two products. We're talking shelves. I'm looking at pictures right here. They're all circled.
Yeah. That's why I'm trying to figure out.
That's
what
all
we should be
illegal.
doing.
It's not like you have one or two things. It's all like, this is illegal. You're talking feet. I mean, there's half a store that's illegal sales. Why don't you just open up a pot store?
Oh, hold on now.
Well, they're not all
cool.
I take that back. That's the thing. I'm not gonna let this, I say we either gonna have to do something with it. If we can't vote on it, then we're gonna have to let it until another meeting.
Yeah, let's do that, so then.
We have to have
can-
another meeting so the tobacco lines can come in.
Continue this
Yeah.
to the next meeting?
Yes, I think.
And I would say, I would suggest that we do it something before October, maybe in 2 weeks. That we come forward, have the tobacco control people come before us.
Is that a
to
motion
clarify
you're making?
exactly, yes.
Is that a motion
I'm going to
somebody's
move that
making?
we continue this for 2 weeks, to have the tobacco control people come here and explain, first of all, why are they charging them as a second offense and not a first offense? Do we have background for first offense or second offense? Which one?
Okay, that makes sense.
Okay.
So our next,
We need to clarify why they are identifying some of these items as warnings and some of them are not. And I would like to get some clarification on what Kevin is talking
Okay,
about,
that makes sense.
about the timing of this paperwork. We
have
do
to make
need to know
in a
that.
motion. We have to make that in the form of.
So
And I'm making all of those various things as part of the motion.
so what's your motion? To postpone this to another meeting in 2
Postpone it.
weeks?
And I think we should do it in 2 weeks. I don't think we should wait for a month.
So our next, to make a motion to postpone this for another 2 weeks to our next board hearing meeting, which will be 2 weeks from tonight.
We should set one for 2 weeks from
Well,
now.
we can do that,
Which would be-
providing we vote on this.
28th,
Yeah, that would be the 20th.
September 28th.
It's gonna be Tuesday,
No, it's a Thursday.
Thursday.
I'm sorry.
Same time, 6 PM.
6 p.m.
Yeah.
Thursday.
Do I have a second?
Second.
Okay.
Roll call. Jasmine Canonis?
Yes.
Gus Steves?
Yes.
Kevin Spling?
No.
Thank you. Dan Grabowski?
Yes.
Thank you. Motion passes.
Oh, sure.
Okay, this public hearing has been, it's ended at 6:48. I will resume our regular meeting.
Thank you.
Agenda item 5,
Thank you for the information.
discuss the increase in immigrants with Karen Salidas, the area administrator for Catholic Charities.
That's me.
Come on up, come on up and give us a nice big smile.
Thank you, bye-bye.
Good luck.
Would you like to sit here?
Ah, sure, thank you. How are you guys?
We're doing, as you can see.
Hi, Karen.
Hi, how are you? So Gus had came in the office a couple of weeks back and we were just chit-chatting about some of the changes that Catholic Charities has been seeing in the recent summer months.
Sure.
And I'm sure you guys have heard that South Sturbridge got an influx of migrant families.
Sure.
We got our
Yeah, which is
first
already
call, it's going on a month now, we got our first call. First it was 30 families. As of this morning, it's 61 families, 178 individuals.
In
Just in
Sturbridge.
Southbridge alone?
And no, in Sturbridge.
In Sturgis?
Yeah.
In Sturbridge, yeah.
I didn't realize it was 178.
Yeah, so there's 59 at one hotel and then the
And then,
rest are
yeah.
at the others. And so we've definitely been getting an influx of calls and walk-ins, people looking for services. We're able to provide some, but there's a language barrier too. I think one hotel, they do speak Spanish. So we have a bilingual office, so we're able to provide some services.
Are we seeing any of these people living in Southbridge?
I don't know. And it's hard to answer that because we're seeing unique housing situations.
Right.
So folks that have been here for a long time are letting other people
Stay with
stay
them.
with them.
Yeah,
Yes, that helps a lot.
Yeah,
Yeah.
yeah. Some stay with them for a long time and some move on.
Right.
There's more services in Worcester, so they are going to Worcester as far as I know.
Yeah.
But just last week, we got a family from Springfield. I don't know how they ended up here.
Yeah.
Yeah, but they're here.
Yeah.
They're here. So we're not quite sure what I mean, we have some services that we can provide to the families in Sturbridge, and hopefully next week we can start doing that. I know they've asked for school supplies. Sturbridge has registered some kids for school, but they need everything from clothing to diapers and things like that. And locally here in Southbridge, you know, I live here in town as well, and you know, we have some folks that are calling saying, what are you guys gonna do? We don't really have an answer for that. Yeah, we don't have an answer for that. We're doing the best that we can. And my boss, while I was listening to the other folks talk, she just sent me an article that I guess that was in the town newspaper in Sturbridge, and it seems like no one really knows what they're doing.
Sounds about right.
Yeah.
I read it.
Yeah, and then, you know, I asked for a contact person, and it's hard to get that, so we have been in touch with Mary Carpenter. She works at the Board of Health in Charlton.
Right.
Sahar Chowdhury, I'm not sure what her title is, from Boston. She reached out to me yesterday, and I said, can you give me some demographic information?
Sure.
Because we get funds from United Way and from FEMA,
Yeah.
but we have to report appropriately, you know.
Well, they put them there, didn't tell anybody
No, I know.
anything.
I know.
Yeah.
Yeah.
Because I'm getting a large influx of referrals too. I work for the executive director of the Kiva Center here in town, and we do a lot of work with Salvation Army, and they pretty much did like a dump and go, honestly. They didn't even say anything to anybody, and they're in Sutton. There's like almost 400 people in Sutton, and
400 people.
yeah, I mean, and
That's
nobody knows like what agencies put them there, what the allotted amount monthly, like it's all like just really bad.
From
Yeah.
my understanding, the towns were aware of it.
Yeah.
The community just wasn't. Yeah. And from my understanding, there are funds, these towns are getting funds for them.
Okay.
And this group that have migrated, they're eligible for certain benefits.
Yeah.
Which has been tough for our folks here that can't get benefits.
No, and there's a lot of double dipping
Yeah.
because they're already coming with certain, but then getting something else,
Yeah.
and there's a lot of double dipping and billing going
Right.
on.
Okay, so I guess what I was hoping we could talk a little bit about is clarify, how is this affecting Southbridge? And what can we as the Board of Health do to help the situation? Because you're talking a lot about stuff that's going on in Sturbridge and other communities.
Yeah,
And granted, they need some assistance, and if we
Yeah.
can work with them, that might be helpful.
yeah,
But I figure if you're based here,
right.
are you seeing these kinds of issues directly in our community?
I am,
You are.
yeah, on a personal level and a professional level.
Okay.
I am. Yeah, I mean, I've stopped people have stopped me at Walmart just last week. I don't know how they knew who I was and where I worked,
Okay.
but one of them had my card,
Okay.
and asked me for assistance. So I just told them to come to the office, you know, and I can provide assistance. I don't do anything on my personal time.
Yeah.
Sure.
But yeah, you know, like I said, the community is definitely calling us and asking what are we doing, and they have some complaints. Some of their concerns are valid, but I don't know what else to do. Yeah, I don't know what else to do.
Well, you're doing something.
Yeah,
You know what I mean? It's not like you're just turning your back for anything. You can do the best that you can.
right. And I told my boss, the director of our entire program, that my number one concern is to serve our community.
Right.
And so I've been very clear when the phone rings and other people want our services, that we need to provide services for our community.
Right.
And I'm not gonna exhaust all my resources and the things that we have to help everyone. So next week, when we do go to Sturbridge, we're gonna do a one-time donation. We're gonna go in 3 loads, possibly four car loads of items, and then that's that. Yeah.
Okay. What do you think this issue needs from the town? And from us specifically?
Because families are trickling into Southbridge, I anticipate that, you know, we're gonna see some homelessness. I know of one family that's already living in, a tent. And we collaborate with St. Luke's, Tony Havens, who is all over. He comes into the office, and I've been using him to kind of see if we can get folks at St. Luke's. But, you know, eventually they're gonna not have the space as well.
Oh, yeah, that's,
Yeah.
there's far too few spaces.
I know Walmart has posted up signs saying no, I think it's no camping or something like that.
Well, technically, our town has an anti-camping bylaw.
Okay,
We've had one for years now. It
okay,
was originally triggered actually by a family that was camping in their van on Elm Street.
okay,
This was maybe 10 years ago.
okay. All
They
right.
lived here for like maybe, they made camp, I'm
Yeah,
talking
months.
years.
Yes,
Wow,
they were here for
okay.
I mean, they went to school, and so their kids went to school in the Whites, right?
Yeah.
Okay. I know that on site, in the back of on the side of our building, I've noticed that we had some overgrown brush, and United Way came in and cleaned it up this summer.
Remember that?
It overgrown because we had a lot of rain, but I went in one day and I noticed that an area was flat. Didn't think of it, and then we had the landscaper come and cut it down, it overgrown again, and there was another area that was flat, and I'm like, I wonder if someone's sleeping on our property. And so I went out there, and there was evidence that people were out there. Yeah.
I mean, I know that Mike Julian has mentioned that he makes his rounds, he's building inspector, and he makes his rounds throughout town and has visited a whole slew of people in various homeless arrangements.
Yeah.
I know that coincidentally, I was over in Cold Forest about a week and a half ago, and I saw a couple of tents in the forest. So I think it's getting a lot worse than it was.
It is, and I think we're dealing with our own folks that are homeless on
Yeah.
top
Oh,
of
absolutely.
the migrant families that are coming in as well.
And Dan, I actually noticed that you emailed us about setting up a site walk on town-owned property for town-owned South Street, wherever it was.
South Street.
The blighted town property. What do we have available in town that the town owns that's in good condition, that maybe we can talk to Jack about using at least temporarily to help with this issue?
Well, we do have a list of town-owned properties.
Yeah.
The conditions would have to be really more thoroughly evaluated.
Sure, exactly.
But there is a list of these properties.
Okay.
Some have been in those conditions, good, poor, or bad, or even ugly,
For
for
years.
quite
Yeah.
a while.
Oh,
Okay.
Yeah.
And you would assume that they've just deteriorated worse. So
Mm-hmm.
that could be a viable approach. But to the very least, it'd be worthwhile discussing.
Right.
And like I said, evaluating. That would generally go through the town manager's office,
Right.
town council, health department, building.
Mm-hmm.
It would be a collaborative effort, but at this point, worthwhile
Okay.
to look into.
Yeah,
You know,
yeah,
um,
yeah.
It's it is a difficult situation. You're looking at it, what would be, what would be sustainable as well.
Right.
That's what I'm thinking, can we sustain our school system, like
Yeah.
there's so
A
many
lot,
other.
of course,
Yeah.
so.
And
But discussions are going to happen.
Okay.
I can tell you that with certain entities and departments
Okay.
in conjunction with the town manager. And we're actually going to, we plan on discussing this particular subject next week.
Okay.
So it's a start.
Okay. All right. All right. Very good. Well, thank you.
Thank
Oh,
you.
thank you for all your work, yeah.
You're
Much
welcome.
appreciated.
Agenda item number 6, discuss Board of Health priorities for fiscal year 2025.
Yeah, this was, if I can start that one.
Go ahead.
I threw that on specifically because it was kind of, and I kind of intended that last time we met, when Dan was talking a little bit about our priorities, about our requirements that, as a board. And I wanted to kind of dovetail that into a discussion of what we think as individuals, our priorities for the next year ought to be. And we kind of never had that discussion, because we went into the public hearing, we kind of never came back to it. So I was hoping we could kind of talk a little bit about what we want to be doing and why, and how we can, and how we can coordinate some of these things. That's kind of what I was thinking. And since I got the floor, I wanted, one of the things that I know that I think obviously we should be dealing with is homelessness. And I think that one of the things I would personally like to see us dealing with is doing something more about trying to get our community, I mean, since health is since food is such an important issue when it comes to health, I would like to see if we can do something to work with the planning people and conservation to help us come up with a better way to promote local food supplies and small-scale local agriculture, and to see if we can figure out a better way to get our community more resilient in terms of our ability to feed ourselves, especially in the long term.
Let me ask you this, I got a question. We have a food pantry, right? Now, how much, I mean, and that's of course year round, how, I'm sure it's used every day then, right? People are coming in to
Yeah,
the food, so
They have
we do.
limited hours.
They have limited hours.
Yeah, they're not open every day,
Because
but
I know
they're
that
very common.
Roger Cowett used to run that thing years ago, and, you
Yeah.
know, and Roger,
It's actually
he's
two.
old.
There's
So,
one
so that,
cafeteria,
so,
there's one
so that's a
upstairs.
big help right there alone, as long as we have something to start with, that's a beginning, but we can maybe build off that a little bit somehow too.
Oh, we have a community
They have that
refrigerator.
at that RMG.
Yeah,
Yeah, they've got that, yeah.
and we just filled it with things from Trader Joe's.
Yep.
So, but the thing is that the need is so much more than
Exactly.
what we can do, especially if we have individuals that are coming here that don't reside here, because the need was already there in a large volume prior to, additional, folks coming into the
I
area.
understand it, but the good part is though, we have these, we have resources to help people. Because I look at, some communities might not even have what we have, but it's good that we have something that we can help the community with. But the thing is, like anything else, it's the demand. But we can, we can, like us, we can maybe do something,
Well, that's why I think of trying to encourage people
Maybe,
to grow some of their own stuff, so they don't have to fall back
Right,
on those
well,
sugars.
I grew tomatoes this year for the first time, I never want to see a tomato again. For 3 months, they didn't show up, all of a sudden, one day they showed up, and I go, Lord, even the neighbors don't
That's
want it.
usually the way it works.
Yeah.
But then you can
Tomato.
freeze them.
Yeah.
And the farmer's market, I increased it to 3 times a week.
Yeah, that's good.
So,
Yeah, I saw that. That was cool.
we have a good
Yeah.
thing going on then. Guys, anybody else? Okay, agenda item number 7, old business. Update on 631 Charlton Street, tree concern.
Oh.
Right.
Christine, the
632 Charleston, oh, okay.
yeah, the property that,
That was the Katie Brook thing, that's the thing we
Yep.
saw, yeah. Well, when we went up there, there was no real issue. It was, the brook was blocked, but the water was still flowing through, and it wasn't really backing up anything significant. Actually, Kevin Buxton and Maureen and I went down and looked at it for Conservation Commission a couple of weeks after that, and it was still flowing just fine. I mean, the wood that was blocking the brook is getting to be bigger. There's a bigger dam-like substance there, but it's still flowing through. So I don't know if it will become an issue, but it is not now.
No worries.
Okay, B, update on,
I gotta-
oh, go ahead, Kevin.
I was just wondering, Dan, Can we get an update? What's the status? We talked about it last meeting, Brick Road. How do we stand with that as far as
With-
the Brick Road, 20 Brick Road? Did we go out for RFPs on that? How do we stand with that?
We're receiving the bids for demolition.
Okay, so it did go out for
Yeah,
that?
yeah,
Okay.
it is. We have, I don't want to put my foot in my mouth, but I believe we've had 2 bids
Okay.
on that for the demo.
Yep.
We also have to look at the asbestos survey.
Right.
I don't know if those were included. But all in all, what we want to emphasize is that we want to take an approach where we analyze everything, not overly analyze, but take account all the variables that are on the table and do it the right way. And this was, again, emphasized by Jack, the new town manager, where he'd like to see an approach taken where we cross our Ts and dot our Is,
Right.
so we don't miss
Right.
anything,
Right.
in legally speaking.
Right.
With that said, it is moving forward. We're anticipating another bid coming in. Then we'll proceed with taking it to the town manager and the town council, which is the directive. We have a lot of support with this brick road, and it's definitely warranted. Needs to be demolished. Again, just to reiterate, we want to do it the right way, and make sure. I'm sure we all will, but we just don't want to miss anything.
Right.
Because it's been a while. A lot of new personnel, including myself. So that is something that I'd like to put on not only Brick Road, but other blighted properties for our next meeting.
Gus has a
Give an
question.
update.
He's
Oh, still want to
Yeah,
go.
I was just, to follow along that Brick Road property, I know it wasn't a Board of Health type thing, but we kind of were there, most of us. What's the status on a cross
I
street
was gonna ask that one too.
property?
The same.
That's already been
Yeah,
out,
yeah, we're moving with that. We had individuals go out and get and evaluate. That one, I believe, is just one. We've only had one bid. We do want to get another one or two. So what we've also found out, if we pursue anything over 50,000, you know, there's got to be notification. We have to post it.
Right.
For bids. So we really want to be diligent. One of the positives there, and something that's going to help us out tremendously, is the possibility of having a lawyer to assist, Rob Caprera. We're looking at that. That hasn't been finalized, but it'd be wonderful to have him back on the team for that support.
Right.
Thank you.
Gus,
I was gonna ask about that, but also, since we're on that subject, where do things stand as far as the Mill Street property?
The fencing, well, that's going to be fenced. Two avenues we can take, whether the town purchases the fencing and erects it, or rents it out. We've done cost analysis, and it seems to us, the building department and health department, that the best option would be to purchase
Okay,
the fencing.
probably.
Yeah.
How much are we talking cost-wise?
Roughly, the fencing, up in my head, was 23,000.
Wow.
It is not cheap, but the fencing should last for, well, if we take care of it, we
Oh,
can.
you get
Sure,
some
right,
life expectancy
right.
out of that fence.
Yeah, so it looks like a good investment too. We can use it for other properties. Now, that's gonna be subject, how long is it gonna be fenced off?
Exactly.
That's why I'm saying
Yes.
we should purchase it, other than, I mean,
Oh, I agree with that.
An
Yeah, that's a good point.
an example, Sacred Heart Church,
Right.
grant, we're not paying for that, but gentleman's been renting it in almost a year now.
Oh, yeah.
We probably would have paid more than 20 grand renting it, we
Yeah.
could have bought it,
Sure.
and after we use it, at least we can use it for other things
Oh,
around
sure, I
town.
totally
if
agree with
need
that, I
be.
totally agree with that.
Well, what I can tell the board members is that we're going to have an on-site visit, myself and the building inspector, fire and police, to really look at the back section of the property,
Mhm.
because there is a business back there
Right.
that relies on trucking and the
Right.
movement of vehicles. So we want to look at ensuring that it's done properly, the fencing installed to protect public health and safety, but not completely impede their traffic.
Right.
So, but again, health and safety takes precedence, and we'll start with a meeting. There are some concerns with the tenants there.
Right, oh, yeah, because I can
Rightfully so.
easily see
Rightfully so.
distance-wise that being a huge problem.
Yeah,
Yeah,
yeah.
absolutely.
So that's where we are.
Okay.
Anybody else? Okay. Item B, update on requests for alternative disposal of textiles.
Sure. There was, that was brought to our attention last meeting about really handling textiles, specifically textiles that are soiled, contaminated. There were questions, what do we do with them? With further evaluation, as I talked to Anna Smith from our department, those items that are moldy, soiled, contaminated, can be thrown in the trash and should be. And so what I'd like to just give you, the members, a handout which she put together to clarify the policies. If we could keep that, it's good to have. We're gonna post it as well for individuals that wanna have that clarification in terms of the textile. Okay?
Is this posted on the town's website?
Not as yet, we're sharing it with you. See if we can get together. Yeah.
Any questions?
About that? No way.
Okay, no, excuse me, agenda item number 8, chairman announcements. I have none. Number 9, health director's announcement.
I have two announcements. Both are in relation to diseases. One, Eastern equine encephalitis, triple E, and the other is our old nemesis, COVID. I'll start with COVID. I have some numbers to share with the members, and this is from Brianna, epidemiologist that we utilize. So I can tell you, I'll go back since June. And June we had 10 positive cases. July 9, August 20, September 8 to date. And she gave me this information on Thursday, 9/7. So that number may increase. But as we've all heard about the uptick in COVID, it's resurfaced and, in terms of many things. And you can see it on social media, newspapers. So,
I had a dental appointment today, I had to wear a mask.
oh, you did?
Right, so I said, if I have to wear the mask, how are you gonna clean my teeth?
Very diligently. You're on it.
But I have to wear a
you're
mask.
right.
They wouldn't let me in, I'm knocking on the door.
Yeah.
I got it.
Getting back to some of the old ways, and masks certainly are coming back in different parts of the country and sectors.
Are we having any issues with the schools?
No.
No.
Not that I know of, and that hasn't been addressed by Brianna or the team, or even our public health nurse, so knock on wood there.
Okay.
So I'll move into Triple E, which you all received the information. Okay, I'll start back with just a synopsis that this, on Friday, 9/1, we did receive an announcement that there were positive mosquito samples collected here. And the level at that point was moderate in the communities of Southbridge, Douglas, Dudley, Sturbridge, Uxbridge, and Webster. Subsequent to that, they were going to be taking more, the state, more mosquito samples as part of their surveillance, which they did do. Information was provided to me this week. That was done on 9/11, and 2 other positive triple E mosquitoes were identified in the town, Southbridge.
Out of how many taken? 8,000?
1,000.
That much? No,
Thought I read like 1,000.
no. They don't provide that information here. Trap site Southwest agents, yeah, the triple E. And those are the details. And so what happens now with there's a risk change, it goes from moderate to high. And with that, there are recommendations made by MDPH. And one of those is certainly looking at addressing curbing, curtailing, however you want to define it, cessation of activities at the hours of dusk to dawn. Outdoor activities. That is a recommendation. That is usually the norm in situations like that. We find it that it's the tail end of the year. The likelihood of an outbreak, human outbreak, is very low. Yeah.
Yeah.
So with that said, we are going to initiate a campaign where we're going to emphasize education, hosting, reiterating good practices, clothing, training standing water, repairing screens, applying insect repellent. So we want to get that information out again, just to reiterate to the public at this point. Okay?
Yeah. Definitely have no concerns with education. I am a little inclined not to favor spraying if we ever have to get to that point. Because I think the environmental impacts of the spraying outweigh the benefits.
Well, we could always opt out, but the Southbridge has never been part of a mosquito control program.
If I can dovetail off of that, since I was just looking it up, and there's been an average of about 11 cases across the U.S. a year of AAA, versus like 30,000 cases a year of Lyme disease. What can we do to address that issue? Because I can guarantee that there are hundreds of people in town that have it right now.
Oh, yeah.
I've had it a few times.
Yes. Unfortunately, it's really become endemic, the Lyme disease here.
I
Personally, myself too, family members and friends. Yeah, that is a difficult one. I mean, certainly the battle with the ticks continues as we faced here in town. But the incidence rates just continue almost every year at the same.
Right.
It's almost like ubiquitous. Well, you know,
It
is.
Yeah.
And I mean, what we can do as a town, just looking at it, is certainly we can address some cultural practices that we need to institute in fields that were not being done. Thinning back the bushes, keeping the really the grass low, you know, instead of relying on spraying. That can also be done with residents on their own, you know, but particularly addressing town-owned properties that could be improved. A lot of vegetation, overgrown. Yeah, to reduce the population density of these ticks.
I mean, I know from being out in the woods a lot, I've seen that the frequency of actually running into ticks has dropped off significantly. Because back in the early part of this year, there were tons.
Yes, you're right.
I haven't seen one in some time. So.
Yeah, you're right. So we're at the tail end, but I agree, in the beginning of the year, I was hiking quite a bit too, and I'd come out 5 to 10 ticks every time I hiked. It is something that we'll be facing that challenge next year. With that said, I think the town should be a lot more proactive and not get ourselves in a precarious situation as we did with the field right there where the ticks were being found everywhere and there was no really approach that was taken previously to address, the population. It did not spray, field maintenance could have been improved and pushed back of the bushes, and the weed growth, I should say there, so, in my viewpoint, that needs to be addressed next year, sooner than later. And that was also reiterated by the pest control company, where if we had taken the initiative, the town, and called them and made that first application long before we did, that would have been conducive to reducing the levels.
Do we have any background on how effective those applications were?
We don't. I mean, it was just simply what the individuals using the fields indicated, right? Which, everyone just said it was much less. They weren't finding them.
Okay, that's
Yeah. So presumably that the efficacy there was good.
okay.
It's what we have.
Okay.
Okay?
I had a question, Dan, to you, if I may, in regards to this triple E.
Yeah.
We were notified September 1st of it. It was a moderate case. So I guess it's maybe a question and or a statement or something to think about. Should that have been something that when we were notified that we should have notified our general public and put that on reverse 911 or maybe posted it on the town's page?
Not at the level.
Because what happened is it went on Channel 5 News and then everybody in town sees it.
And that's
They freak out. My phone rang. Hey, what's going on? I unfortunately, with email error, I didn't have an answer. But is that something we should maybe think about in the future, putting it either, and the reason why I ask is I know Dudley and Webster were in the moderate as well, but they did their reverse 911 on it and put it on their town pages on that September 1st, and we didn't do it until like yesterday.
It works both ways. I've seen it be advantageous and not. It stirs the pot as well.
And that's why I'm asking.
It really does. And that's something that we should discuss. It's usually a rush, and I remember that day on a Friday, and ready to leave and get that call, and Jack and I were here battling it ourselves, doing what we could. It is getting the word out, and it's a challenge. It really is
I don't know if there's something we should come up with certain
Reverse
criteria we have to
911,
meet before.
we
it
could.
goes, or-
We
I mean,
could, and we
the
should.
town does have
I
the
agree.
reverse 911. We
Yeah, reverse 911.
spent a lot of money on that. I mean,
Yeah, that's not cheap.
I don't think we used that system
We
to the fullest.
could collectively look at that and enact a protocol, because I think next year it'll be back again. What levels does the board want
That's what I'm
to?
saying, we set
you know,
criteria.
Yeah, criteria.
Because I know
Agreed.
that 911 system in town underutilizes that system that we have. You can actually go on the map and circle a section of town that those are the only ones you want to receive the call. To say whether there's a power outage in your area or
That's interesting.
that system is a pretty intense system that
Then we should
have
put it
that,
to use, yeah?
food for thought, certain
Yeah.
criteria.
If I can add to that, given we're talking about Triple E, I just called up the CDC's website. As of right now, there have been a grand total of 6 human cases in the U.S., and they've all been in Louisiana, Alabama, and Florida.
Interesting. So wow.
Louisiana, Alabama, and Florida,
That
6
pocket.
human cases of Triple E.
That's Triple E. Okay, so that's my statement. And again, good food for thought. We'll discuss further.
Okay, agenda item number 10, board members' announcements. Any board members have anything to say? Kevin, go ahead.
On the topic tonight. At the last meeting, I asked Dan, and he provided me with a list of 10, 11 properties that we had on for blight. I don't know if everybody has seen this list that was in the past.
We've gotten that before, yeah.
So I took the initiative to drive around town, probably to
Well,
90% of town roads.
we've gotten this before.
And I came up with these additional properties that
Oh,
I
these additional?
think, yeah, these are additional to the 10 or 11 that I personally, my opinion,
Yeah.
think that this board should be looking at and determining if it's a health thing or not. I mean, the last two, you see there's no actual number on there. It's,
As far as
you can't even see the number because it's,
the one on Jennison Street, that's on the other side of the street where I live. I already know the house you're talking about. That house, well, I shouldn't give any names.
don't give them in.
I know who used to own it, and he died. And his son failed to make tax payments on that. So in other words, the house, I don't think the town owns that house. In order for the town to own a house, the tax rate has to go beyond half of the value of the house. Basically,
Well, they have to actually take it in tax.
right.
They can
But,
they can accumulate a lot. and
But the
ta-
thing is,
town
on that
has to
house
pay
right
it.
there, the owner, and I know you know who he is, he doesn't have the money, he didn't have the money when he inherited it. And that was like maybe 15 years ago, maybe 12 years ago. Basically, that's, as of now, I can speak on behalf, that's just there. I mean,
It's been, if
it's the White House on the corner, right on the corner of Old Woodstock Road.
And then look at the one above that one
Yeah,
I'm
that's-
talking about.
yeah.
Right, and that house too, I believe, right,
Same.
that could be the same owner.
It is.
I believe it is, yes.
But what my point I'm trying to make is a lot of these houses that you see here, a lot of these houses, the one on Dressel Hill Road is right across from, Southbridge Tires Warehouse, where they sell the mulches and stuff like that, going towards, Charlton, towards Sid's Auto Body, going to Dressel Hill
Oh,
Ice
yeah,
Cream.
yeah.
Just across the street on the right-hand side, that house has been vacant good 10+ years.
Wow.
And if you go on, I'll move up the one on Apollo Drive. That house hasn't been touched in at least 7 years. A lot of these, the Charlton Street one that I have there, that house was done from the hurricane that came through, and it's just been sitting there. It's, these houses, the Litchfield Ave one,
Yeah.
that's been vacant for years. I mean, in these houses, I'm talking the grass is above the windows. Like, it's, some of these I can't even put numbers on because I can't even read the houses. I think what we need to do is, we need to start looking at these properties. And me personally, if I had to own a property next to this, I would be upset.
The thing is about the Jennison Street one, that used to be a beautiful house. I played there when I was 5 years old. I mean, the house used to be immaculate. And the thing is, that house can be saved. It's not beyond, you have to put work into it, but you can redo that house. You know, it's gonna cost a few bucks, but you can bring that house back to life. The 87 old North Woodstock Road, that's just forget it. That's,
See, and I agree with what you're saying, and I agree, my opinion is, the last thing I would wanna see done is a piece of
Right.
property be raised. Because if you raise that property, it comes off the tax, and that's what should not happen. But I think what it is the Board of Health has to work with different departments in here. We have to get, like, the inspections department, we might have to get the treasurer involved and stuff to find out, are there back taxes due on this property? Can we make them clean up this property? Is the property even, the house itself or the building or the structure structurally sound for somebody to even be in that? I mean, some of these properties, and it's not, I've driven past properties in town that numerous unregistered vehicles on that. It's not a Board of Health thing, but that's another thing he had brought up in a different department. But my last thing I don't want to see done is for a property to be raised and come off the tax. Because, the thing is, I like to see it, if it is rehabable, let's get the ball rolling and get something on it. And I know it's happened in different committees I've sat on, something comes up and it sits and years go by, and I want to try to see if we can stay up on top of this blight. I mean, between my list that I came up with and the previous list, I mean, there's 20, 21 properties, And I just wanted you guys to see the list, and
Oh,
if you're
that's
out,
good.
you're thinking
Good
about
enough.
it, take a look. You know, some input, a lot of these houses haven't been touched in years.
Oh, yeah, most of them.
It's,
It's
I
unfortunate.
know the one on Genesis Street in the 87 Old Woodstock Lakeside, I know the owner.
Yeah.
Yeah, it is a tax issue, and the thing is, he doesn't have the resources. He got out, the reason being, because he couldn't afford to keep both houses. So the facilities were shut off, whatever they shut off, they illegally shut off.
yeah,
And once that goes, the people go.
right, and I just, you know, like I said, I feel bad for the neighbors that have to see, you know, even if it's just, if the, and like I said, I'm not sure if it's a Board of Health thing or an inspections, or, you know, hey, let's mow the lawn, let's,
Yeah,
you know, we
it's
can't.
it's a town thing, you know, as you said, it's years and years. And when I came here, I inherited this. And it
Exactly.
was dropped, and one of my questions was, why has it been going on this long?
Exactly, and there's
And
that
I faced a lot of different excuses.
Yeah, that's
I
the
mean,
thing.
it affects our police and fire, I mean, they have to go for a
Oh,
call.
sure,
And
agreed.
the thing it kind of brought it up to me, and it's the next thing I wanted to talk about, and it's been mentioned numerous times tonight by previous speakers, us, is the homelessness problem in this town.
Oh, yeah.
And
Yeah.
it's bigger than people. There are homeless camps in this town, and one of them is right on our main street,
Yeah.
that people don't realize.
Yeah.
It's right behind my garage. They have a tent city behind my garage.
Hmm.
Mhm.
There's one, you saw it up on Cold Forest,
Yep. There's only a couple
by the
there.
senior center.
One or two of them, yeah.
Go for a walk up there again.
But there's more.
It's-
They
and
were-
I'm
they were-
afraid
they were
that-
here when I was there.
I'm afraid now they're gonna start seeing we have properties like this, and they're looking to get into places, winter's coming, cold
With
times
the
coming. So
caution.
Oh,
this,
totally.
this is, you know, this is what's making me nervous about the back.
Which is why we want to see if we can, which is why I was suggesting earlier that we can see if any of those are salvageable with a little bit
Exactly.
of investment, so we can actually put people in there. I'd rather have them be there in a facility where we know they're warm and safe, rather than having to break into the place and possibly set it on fire,
So I guess
or
my,
something like that.
my thing is, I'm looking for guidance to see how we can do it where we get the department heads, council involved and do the walkthrough that we did on Cross Street, the walkthrough we did
Yes.
on Mill Street,
Yes.
the walkthrough that you're planning to do on South Street. I think that's the greatest thing.
Yep.
But see if we can,
Yeah, we can, and we call
I mean,
them
I know,
our
I know
field
the
trips.
list, I know the list is long, and it's not
No,
something that's gonna
no,
happen
we
in
can
a day, a
tackle.
week, a month. But if we keep it on the horizon, I just don't want stuff to get put on the back burner.
No, no.
And that's the
You know,
case, a lot of
Thomas
stuff
Street,
is.
Thomas Street's been on the back burner for years now, and
No, I agree.
it's time to get off
We
the
can
pot for a
incorporate
second.
a field trip. I think the response has been great.
I
For
thought it was
everybody,
great.
You know, it's an eye opener for some, but it's a way we can all address some of
Everybody's on
the
the same
challenges
page.
right there.
Everybody's on the same page,
Yeah,
so it's not
everybody's
about unit
Yeah,
trust.
we
and-
can
Yeah.
call out, and again, we're gonna do the South Street. There's still a couple months left of good weather, I
I
say.
like that. I like
if
that
not
idea
more,
of
and
showing
we
everyone
can take
what's going
another
on.
one and just hit a few.
No,
you know?
like we did that night, we
Yeah.
did two of them that night,
Yeah.
and I think, me personally, just town hall wise, Thursday nights is a good night.
Yeah, that's true.
You're here
Thursday?
till-
Yeah, yeah.
Well, you're here till late,
Good.
Marissa's here till
Great.
late. You know,
Yeah.
a lot of the town employees are here till late anyways, not tax
Sure.
them
We can
staying
do
after
that.
hours or.
We'll take on that as with coordinating, you know. Maritza sends out an invite, and we get a
Yeah,
usually
that's-
good response, pretty clear, let's meet here, and then we'll go down the list, you know?
I remember a few years ago, the town, I think it was back when Chris Clark was town manager, he used to do regular visits to look at blood.
Yeah.
With the health department at the time, and a variety of other people who wanted
Yeah.
to show up could. And that seemed to have some impact. It would be nice maybe if we started trying to do that again on a regular basis. I want to say they did it every month, maybe. I can't remember exactly.
Interesting.
That was a while ago, though. It was like
Food
10
for
years
thought.
ago, so.
Yeah?
Yeah, with the manager and whoever else can show up.
Well, like I said, we got that South Street, another one,
Mhm.
and I agree with you, it's time.
Yep.
Time we start addressing them more thoroughly, instead of just talking around the table, you know? Which I believe has been done for many years here.
Oh, yeah.
And where has that really gotten us? So, yeah, we'll do.
All right, and the last thing, what is the process, well, how does it work? I had a call after our last meeting, so on the 11th, about a dresser that's been,
A dresser?
bureau dresser,
Yep, yeah.
that's been sitting on the curb since like the 7th, and I got a call again tonight because they knew it was the meeting and asked me to bring it up to remind me, and I drive past it every single day, and it's still there over a month. What's the process, or what do we, as the town, do about that? And the person that keeps bringing it up, it's just kind of ironic, it's sitting right down the street.
It's the ones close by, yeah.
And there's one.
Well, again, it takes time to get these corrected, but they have to be identified to us, you know? Whether it's picked up by one of us being on the field or so, really we rely on someone making a complaint or informing us, you know, because we can't hit all the areas, you know? And sometimes, hate to say it, these dressers and things blend in, you know? And then a month goes by, but putting it on our list, because we do accrue a list weekly.
Okay.
So, we have a curbside enforcement, Hector, will do it. Myself, and even Maritza's been taking on that responsibility since we are without a health inspector.
All right, just so I can get an answer back.
Yeah, so the best, I mean,
And then reach
what
out
I
to
would
you.
suggest to all of you, when you get a concerned citizen, either call us or have them call us. You know, they can stay anonymous, but give us a quick tip. We'll follow through. Without knowing.
Is it
again,
anonymous for everything?
Huh?
It's not anonymous for everything.
Well,
And
It
that's,
isn't, it
that's
isn't.
where the problem lies. If somebody comes to the town hall to file a complaint.
our
have to
complaint
put
form
that
can, it's you can put an anonymous complaint. And we don't dwell into it. If somebody comes in here and let's just say somebody asks who the complainant was, well, if the name's not on their information, that's not given.
Okay.
Yeah.
We have
That's good
complaint
to know.
forms on the website as well.
And we really want to use that more formal process, so we have record of
Right,
it.
that makes sense.
What I'm saying, you know, instead of someone just leaving a message, you know, a
Email,
voicemail, or
for email.
those can be missed too. But you know, a lot of just a voicemail, and what if we don't get to it, or if it's, you know, it's not, we can't understand it or something, and they just hang up and believe we got it. No, the form would be the best, and is the best route to take.
Okay, thank you.
Okay.
Anyone else?
No?
Okay, agenda item 11, schedule next meeting,
The 28th,
which is the 28th of September, 6 PM, Thursday night.
do we know if this room's open or not? You wanna check that?
I'll go check on it later. If not, we can move into some other room.
And we're only having that one agenda item?
Right,
Yeah.
exactly,
Okay.
one agenda item. And
Motion adjourned.
agenda, 12 votes to adjourn,
Second.
second, okay.
Jasmine Canonas.
Yes.
Gus Steves.
Yes.
Kevin Spillane.
Yes.
Dan Grabowski.
Yes.
Motion passes. Meeting
Thank you, folks.
adjourned at what time?
7:40.
Thank you.